A stroke, or cerebrovascular accident, CVA, is a term you've probably heard before. But did you know that your body can sometimes give warning signs at least a month before a stroke occurs? If you notice any of the signs I'll discuss in this video, it's essential to see a doctor quickly. Early diagnosis can make a significant difference and reduce the risk of severe brain damage. It's important to understand that strokes don't discriminate based on age, gender, or health status. Even young and healthy individuals can be affected. In the United States, strokes remain the leading cause of death. Each year, more than 795,000 people are affected, and nearly 159,000 lose their lives to it. In the next few minutes, we'll explore together the 5 symptoms that can appear up to a month before a stroke. You'll also discover tips to prevent this condition and avoid becoming part of these alarming statistics, so please stay focused. This video could save lives. Don't forget to share it with your loved ones. I'll also explain the differences between ischemic and hemorrhagic strokes. We'll discuss brain aneurysms and transient ischemic attacks, TIAs, which can occur before a major stroke. Let's dive right into the 5 warning signs we just mentioned. Unusual or extreme fatigue can sometimes be an early warning sign of a stroke. Of course, fatigue can have many causes, but if you experience intense and persistent fatigue different from what you're used to, without an obvious reason such as physical exertion or lack of sleep, it's important not to ignore it. This abnormal fatigue may be linked to changes in blood flow to the brain. It can result from the narrowing of an artery due to atherosclerosis or the formation of a blood clot, disrupting the delivery of oxygen to the brain. If you feel this kind of extreme fatigue, it's crucial to consult a doctor. Sometimes it can precede a transient ischemic attack, TIA, a temporary interruption in the brain's blood supply. The symptoms are similar to those of a stroke, but are short-lived, usually lasting from a few minutes to a few hours, and don't cause permanent damage. In these cases, the body often dissolves the clot quickly, causing the symptoms to disappear in less than 24 hours. However, these symptoms should not be taken lightly. They indicate an increased risk of a stroke in the near future. Chronique hypertension, if not properly managed, pose a significant risk of stroke. Blood pressure measures the force of blood against the walls of the arteries. When it's too high, what we call hypertension, it can cause serious health problems. It can damage blood vessels, weaken them, narrow them, or over time, cause them to rupture, which significantly increases the risk of a stroke. When a blood vessel in the brain ruptures due to hypertension, it can cause bleeding, leading to a hemorrhagic stroke. On the other hand, if hypertension damages the arteries supplying the brain, it can reduce blood flow or cause an obstruction, resulting in an ischemic stroke. As you can see, controlling hypertension is absolutely essential. A sudden and very intense headache can be a warning sign of a stroke. However, it's important to note that not all headaches are linked to a stroke, and not all strokes cause pain. In the case of an ischemic stroke, the headache may result from a blockage in the brain's blood flow. These headaches are usually sudden and severe. During a hemorrhagic stroke, which occurs due to bleeding in the brain, the headache is often linked to increased pressure inside the skull caused by the bleeding. This pressure can lead to extremely severe pain. Witnesses of a stroke often describe seeing a person clutching their head with an expression of acute pain, sometimes followed by a loss of consciousness. This headache is often described as the worst headache of one's life. In some cases, an intense headache can also signal an imminent risk of a ruptured brain aneurysm. Sudden changes in vision can be an indicator of a stroke. Blurred vision, trouble focusing, or even double vision may signal circulatory disturbances in the brain. These symptoms, while they can be caused by other issues, should always be taken seriously. For instance, sudden vision loss, could result from a blockage in an artery supplying the eye, which may indicate an impending ischemic stroke, the most common type of stroke. Sudden numbness or weakness in the limbs, especially on one side of the body, can be a warning sign of a stroke. This can also occur during a TIA, transient ischemic attack, which, as mentioned earlier, is a temporary interruption of blood flow to a part of the brain. While these symptoms may disappear within minutes or hours, they should never be ignored. They could indicate an impending stroke or other neurological issues. They differ in their origin and the way they affect the brain. An ischemic stroke occurs when a blood clot or plaque blocks the blood supply to part of the brain. This clot may originate from other parts of the body, such as in the case of atrial fibrillation, an irregular heart rhythm. A hemorrhagic stroke, on the other hand, happens when a blood vessel in the brain ruptures, causing blood to leak into brain tissue. This rupture can be caused by weakened blood vessels, often due to an aneurysm or an arteriovenous malformation, AVM. The resulting bleeding increases pressure inside the skull, damaging brain cells and disrupting brain function. A brain aneurysm is a weakened and dilated area of a blood vessel in the brain, forming a sort of balloon filled with blood. This weakness in the vessel wall can develop slowly over time, often without symptoms, but it increases the risk of rupture. If the aneurysm ruptures, it can cause massive bleeding in the brain, leading to a hemorrhagic stroke. Here are some tips to reduce the risk of a stroke. Control your blood pressure. If it's too high, it can damage blood vessels and increase the risk of a stroke. Monitor your blood sugar. If you're diabetic, maintaining stable blood sugar is crucial to reduce risks. Maintain a healthy weight. Obesity increases the risk of a stroke, so it's important to keep an ideal weight. Exercise regularly. Aim for at least 150 minutes of moderate exercise each week. Choose a healthy diet. Eat fruits, vegetables, and fiber-rich foods while avoiding processed products. Limit sugar, saturated fats, and alcohol intake. It's important to reduce these elements to protect your heart health. Quit smoking. Tobacco is a major risk factor for strokes and many other health problems. Sleep well. Quality. Sleep helps maintain stable blood pressure. Manage your cholesterol. Excess cholesterol can lead to plaque in the arteries, thus increasing the risk of a stroke. Thank you for watching this video. If you found it helpful, don't forget to comment, click the like button, and subscribe. See you soon for more content. And most importantly, take care of yourselves.